Hey everyone, this is Dr. Malik Ali and today you're going to learn one of the best, well-rounded and easiest hip mobility routine. So when you have tight hips, people tell you to do a lot of butterflies and hamstring stretches, but that's just a load of BS. If that worked, you wouldn't be watching this video. So my approach to hip mobility includes almost 20 large and small muscles, and it's one of the best things that you can do. It's better than most of the paid programs that you would find out there. And if you could stick to this, your tight hips will melt like butter. So in order for your hips to be mobile, you need to work on 5 major movements. So the first one is called a hip hike. And if you can't even do that, then you're stiff AF and you need to start there. Our hips hike when we walk, run, work out, or do basically anything where we're moving with our legs. So you will need 4 to 6 inches of elevation. If you're at home, you can use a book. Next, you're going to use a dowel. And again, if you're at home, you can use a broomstick. So you're going to stand with one leg on the elevation, and from there, you're going to hold tight onto the dowel and lift the leg that's down on the floor, you lift it up. From there, our goal is to lift this bony part up higher than the bony part over here. If you use your index fingers, you can find it around your waist. It's like 2 to 3 inches from your belly button and out to the side. And you push really hard through this foot, really hard. You keep going up until this hip is higher than this hip, which is called a hip hike. Now you hold that for 2 to 3 seconds. You're going to feel a lot of heaviness on this foot and a lot of glute squeeze over here, which is what we're working on. After 2 to 3 seconds of hold, you're going to slowly let this foot go down, and then you just let it hang there and feel a stretch on the same glute. And from there, you do the next step again by pressing down really hard through that foot, lifting up this other side, holding for 2 to 3 seconds, bringing it down, holding it for a second. Make sure you don't put your foot down. You stay really heavy. Don't let the knee bend. Again, push hard, push. Hike it up, and then slowly bring it down. This dowel is going to help you with your balance. Just make sure you're not using it excessively to push up and not working this leg. So that's our hip hike. The next movement is hip flexion. Now this is hip flexion, but then this is also hip flexion. So when you're lifting your leg up and everyone's telling you to strengthen your hip flexors, that's good. But if you're glued and your hip joint capsule cannot expand, it's not going to allow your thigh bone, your femur, to move in and expand this area and be able to move in without causing any tightness. Now, a lot of times you guys train your hip flexors doing either weighted hip flexor lifts or through using a cable or any other kind of weight, or even body weight, which is good. But if you don't have space here, you're going to keep feeling this pinch, which means there's lack of space in the joint and you're just forcing it to create movement. So we're going to work on mobility, which is your ability to actively and with control be able to go into a certain movement. Right now, that is hip flexion. So we're going to do some hinges. So you can do the hinges without any reference point for your knees, but for beginners and even for myself, I prefer having something that tells me where my knees should stay, because if your knees move back or forward, the weight shifts to a different area. And right now we're trying to work on the glute and the hip capsule. So you're going to use a bench. If you're at home, you can use a sofa that you can kind of slide your toes under, or a bed that's not too high. So you slide your toes under the sofa or the bench, and from there, looking straight, you're going to bend your knees. Now, once your knees are bent, you make sure your index fingers are on those bony points, and you're going to hinge over, which means you're going to make your butt as big as you can by moving it back as your chest goes down, but your knees stay in place so they don't push or they don't move back. They stay there. So that's why we need the reference point, and it works really well. So we keep our fingers here and then slowly go into a hinge. as you keep going down, you're going to start to feel a stretch on your glutes, your hip capsules around the sides, back, a lot of pressure on your feet, and maybe a little bit of your calf muscle. Now from here, you're going to come up without taking your knees back. So you keep your knees there and you push your feet down and your hip forward, and you don't use your back or your neck. Bring it up, 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 all the way up, but you still don't take your knees back until your set is done. From here, you go down again. Slow, 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 slow. Make sure the stress is going into your glute muscle. And as you're going down, you're not pushing into the bench, you're just keeping it in contact. And then slowly coming up, 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 all the way up. Now, once you're comfortable with the double leg hinge, then comes the real part, which is the single leg hinge. Now, a double leg hinge helps you open up your hip capsule and the glute muscle, but a single leg hinge, that's where the magic lies. So it's the same thing. You start here, your feet, your toes under the bench, you bend your knees, and then let's say I'm going to do it on my left leg, or let's do it on my right leg. So I'm just going to lift up my left foot and keep my toes like this. So now I feel a lot of weight, actually most of the weight on my right side, and there's not a lot of weight here. Like I can lift it up if I want, but I still keep it down because as I do the hinge, I don't want my hips to open up. That's why we have the reference point, so that everything keeps facing this way and the stress goes back into the right glute. So now stay here, same thing. You can use your opposite hand and use the middle finger on the bony part, and then same side hand on your glute muscle, and then you guide that bone into your glute. Now this one, you gotta be really slow and careful, otherwise you might end up using your back because it's a lot of stress on one side only. And again, making sure you're not pushing or taking your knees off. From here, you push, 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 come up. Don't take your knees back until your set is done. So that is how we learn to do hip flexion without feeling any pinching on the front. So the next movement is extension, and for extension, now we're going to do bridges. But most of you people do it wrong, and your PT is too busy with 3 other clients to give a shit. So today I'm going to teach you how to do bridges the right way. Now this one is more of a hip thrust movement, but we're not really going to thrust our hips forward. We're going to do it the same way we would do a bridge on the floor. We're going to use a bench, or you can use a sofa or a bed or even a chair that has a nice room where you can put your head back, and a yoga block. If you don't have a yoga block, you take a big towel, roll it up, there's your yoga block. Now you're going to keep the tips of your shoulder blade on the edge of the bench, and then the yoga block goes between your knees, and then you let your butt go down. I want you to think your chest facing your thighs. You push really, really, really hard through your feet, and you think of your knees traveling forward as your glute squeezes, and your back should actually feel relaxed. Also, I don't want you to look down, round your spine or anything, just nice extension there. Make sure you're not extending through your back, you're really pushing hard through your feet and keeping the yoga block over there. Bring it down again, chest facing your thighs, and then pushing really, really hard through your feet. Push, 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 push. Again, the goal is to lift up these bones, not your ribs, these bones. Push, push, push. Feel the glute squeezing for 2 to 3 seconds. Bringing it down. Again, push, push, push. The goal is to squeeze your glute really hard and lift these bones as high up as you can and hold there for 2 to 3 seconds. and then you bring it down. Next up, we're going to work on internal and external rotation. But again, we're training mobility. That means actively being able to get into a position. So we're going to try to do that without forcing any compensatory movements. So we're going to do hip circles. Now, when I say hip circles, I mean hip, not spine, not pelvis, not anything. We're going to go into external rotation and internal rotation. So first we go into our internal rotation. So you're going to make sure that you're really well balanced on all fours. And then let's say we're working on the left leg first. So you're going to lift it up, move it back. Now the goal is to make sure that there's very little movement of the pelvis and the spine, right? So I don't want you to do this. I don't want you to do this. I want you to be really cognizant of your movement and make sure that you're moving through the hip mostly. Obviously, there's going to be some movement, that's fine. Now you bring it out, you make a circle as good as you can, and then you put it down. So we go again, lift it up, bring it around. Now as I'm coming up, I want to make sure it stays a hip circle and doesn't become a spine circle, so I don't do this. Again, I'm making sure that the rotation that I'm getting is purely through my hip. So I bring it down, put it down. That's going to be your internal rotation since you're bringing the leg in. Now we go out, lift it up. So again, you can go forward as long as you can make sure that you're not moving through your spine. Bring it out and then put it down. And I've attached a rep scheme in the caption so that you can progress without overloading yourself. Now, if you're actually serious about fixing your tight hips and lower back pain without feeling weak and fragile, then I'm a physical therapist who predominantly work with people with these issues for years now. I've helped hundreds of individuals like you get to a point where they don't even have to think about their hip and low back pain while doing their intense workouts. So if you're really interested in my one-on-one program where we do a detailed eval, find the root cause, make a plan that adapts every 2 weeks, and then I keep you accountable for the whole 6-month process, then comment HIP and I'll personally reach out to you. Also, stay tuned for more of my free trainings coming soon. Subscribe the channel for more practical rehab advice.